Good morning. Here we are again. More practice questions for the lungs. Helpful for Step 2 CK, IM Shelf, IM COMAT. Let's get into it. Go ahead and take a moment and pause and answer the question for yourself. It's only helpful if you take the time to really test yourself on this information before we jump into it. All right, let's jump into it. So here it's asking us, which of the following is the likely pathogen responsible for the condition? So we have a 68-year-old male. He's in the ED. He's having pleuritic chest pain, dyspnea, and decreased breath sounds in the lower fields. X-ray shows lobar consolidation on the air bronchogram in the right lower lobe. I'm going to go ahead and highlight what is critical in this question, as well as show you the answer as we proceed. I hope you're thinking pneumonia. With the lobar consolidation, the findings on X-ray, it really turns this question into a simple, what's the most common cause of pneumonia? And whenever you hear that, I want you to always think strep pneumonia. If you don't know and it's a pneumonia question, just go ahead and guess strep pneumonia. The most common cause of community-acquired pneumonia, both in compromised and immunocompromised and non-compromised individuals. And so if you had to make a guess, it's always a pretty safe option, especially here. They're not very specific on what's going on as far as that type of pneumonia. You don't see diabetes, so we're not thinking Klebsiella. And so when they just give you general pneumonia, it's always a safe bet to put strep pneumonia because it's the most common cause of community-acquired pneumonia. Answer A, Haemophilus influenza can also cause community-acquired pneumonia, especially individuals with underlying lung conditions, but it typically presents with a more insidious onset and is more common in older adults. And once again, it's not the most common cause of pneumonia like strep pneumonia. C, Mycoplasma pneumonia is a common cause of atypical pneumonia and is often seen in younger individuals. It typically presents with a gradual onset of symptoms, persistent non-productive cough, and is usually less severe than the typical bacterial pneumonia as seen with strep pneumonia. And once again, it's not the most common cause. Pseudomonas is more commonly associated with hospital-acquired pneumonia and is often seen in individuals with cystic fibrosis or those who are immunocompromised. Klebsiella pneumonia can cause pneumonia, especially individuals with chronic alcoholism. It typically presents with sudden onset of symptoms and is associated with significant amount of bloody currant jelly sputum. In summary, all of these pathogens can cause pneumonia. The clinical and radiographic findings in this patient presentation makes Streptococcus pneumonia the most likely culprit. Other pathogens have specific clinical characteristics and risk factors that are associated or more important for specific clinical characteristics and risk factors that are important for differentiation. So there you have it. Please like and subscribe, and I'll see you in the next one.